Good morning, everyone. This is Michelle Hughes from Ageless and Timeless. Sorry about the very hoarse voice today. I've been talking a lot the last few days of my travels to my family gathering. And I think I caught a little cold being on an airplane. So, anyway, our guest today is someone I've been dying to have on my podcast for a very long time. I've known of him through several people that we know in common. Dr. Robert Goldman from American Academy of Anti-Aging, who's the co-founder and a good friend of mine, and has mentioned Dr. Ghen to me, as well as Roberto Bateta from Hue Light USA, who's another very good friend. And Dr. Mitch is the scientific advisor for Hue Light, so he'll be talking to us a little bit about that today, about that responsibility. And my personal physician, Dr. Nina Sashdev in Beverly Hills, is a very good friend of Dr. Mitch. That's just three people, right, Dr. Mitch? And we probably have many, many others. And I just want to say, before I let you take over, that you are one of the most peripatetic, omnipresent forces in the medical world. And, you just can't even begin to talk about all your accomplishments. It would take me the whole hour that we have today to tell everybody. So I'm going to let you tell people what you're most proud of and your journey to this place that you are at today. So why don't you take over? Welcome, Dr. Mitch, to Ageless and Timeless.
Oh, Michelle, thank you so much. It's a pleasure to be on your podcast today. And I don't want you dying to have me on. I'd rather you live a long life. You have a lot to do for everyone. So stay with us. And I appreciate the introduction. It's very nice. And yes, we probably have a lot more people in common. You asked me what was the most important part of my being in this space. That answer is probably multifactorial. And I think what I need to do to explain that to you would be best to go back to when I was the chief intern of a hospital many years ago, since I've been in this space 44 plus years. And as the chief intern of the hospital, I watched many people that were assigned to different internal medicine groups get out of the hospital at varying rates. But there was specifically one group that got people out of the hospital much faster. I'm talking days faster. I'm thinking, what did they do that I don't know about? So I watched very closely and I noticed, and we're talking a long time ago even to say something like this, but they were using very high dose, like 50,000 milligrams of vitamin C intravenously. So to me already was, whoa, this is very different than what I was trained about in medical school. Actually, in this second semester of medical school, we actually did an assignment in physiology, the study of functionality. And they said, everyone go grab your urine. We're going to check it for vitamin C. Now take 500 milligrams of vitamin C by mouth and then check it again in an hour. Oh, look, a lot of it's in the toilet already. And I said, but there was something obviously I didn't understand. That experiment was pretty much skewed and left out the fact that physiologically, the use of that vitamin C lasted up to 3 weeks. So there's something I didn't know and something I needed to know. So at this point, I'm saying to myself, what would be my objective in this lifetime as a physician? Could I just go along and be sort of the run of the mill and do what I was taught to do and provide medications and band-aid everything and use the if-then philosophy, meaning that if you get something, we'll do something about it. If you have high blood pressure, let's give you a medicine. You have cholesterol, let's give you another medicine. You have diabetes, we'll give you another medicine. And then I said, gosh, that isn't fixing anything. It's band-aiding the issue. And I realized that for me, I needed to look at a question that was hardly asked, and even today in the medical community is often not asked, and that's WHY. Why, Michelle, do you end up with these issues? Why suddenly at 18 you don't have high blood pressure? You do now. Why suddenly at 18 you don't have diabetes? Now you do. And that why would always pretty much rotate back to the biochemistry and or physiology of that human And the only way that me as a physician could think out of the box and change things, and I'll tell you what I mean by change things in a moment, is to know someone's biochemistry and individual physiology. In other words, how do they function? What is it that's causing? What is the why that's causing them to have these specific issues? And so that's when I started my look into this, realizing that my objective was maybe not, Mitch, to think in the box, maybe to learn to think outside of that box so I could provide patients worldwide. And at this point, of course, physicians too. I've trained over 3,800 physicians with the information of how to take that individual cellular biology, because we're what, 100, 200 trillion cells, and make use of it so that I could do one thing spectacular for that patient, and that is to create optimal health, not just good health, but optimal health. And optimal health really is described as close to youthful health as we can get. And by doing that, behind that would come this quantity of life. It's not about quantity, as you know, Michelle. It's specifically about quality of life. And that takes a lot of doing. And that was my objective for coming into this space. I recognized that early in my career when I saw these doctors get people out of the hospital much more easily. And because of that, my career has gone in that space. And I've been very blessed in, having hundreds of physicians see me when they're sick. I've done a lot of media exposure. As you know, I worked for Jamie Foxx for 1 3/4 years on his program, and I've been nationally syndicated, currently am, and giving the message to people there is a right way and a wrong way to approach the human being. So you have optimal health. Again, it's about quality. Do you want to be healthy, quality, or not? And if I could tell you a very interesting story, if you choose, I'm just trying to talk so you don't have to talk so much, because a lot.
I love this, and I know our viewers are going to love this because you're just so fluid and you have so much knowledge and experience, and you're so willing to share. This is what I think sets you apart from so many others in the space, is that you want so much to give back, and you are so generous with your time and your passion and your enthusiasm for creating a better world through lifespan and health span. So yes, please go on. Tell us your story.
Yeah, I will tell you the story. And what you said is true. I live my life in a space with the adage in the back of my head, and I wish my mom was still here. She's not. But I always say, treat your patients like you would treat your mother. And I really believe that's a great adage. What can I do? And I do everything possible. In addition to the science portion of it, I treat people, as I always say, treat them with respect, with honor. I literally give my cell phone number to every single one of my patients.
Right, I saw that. I think that itself is very unusual. And you're very lucky that you can practice medicine with a concierge approach rather than being structured through the health insurance and pharmaceutical structure that, primarily the medical institutional structure, which, if you're going to collect insurance from your patients, very often you have 15 minutes. And how can you possibly help someone in a very limited time? I think that's one of the big deficits of our system today. So many, many people have chosen to use you in a way that they get your full attention for a longer period of time, so you get to know them as individuals.
And I do. And for the past, it's more than 18 and a half years, Michelle, I've been basically a cash practitioner. And I've done that because I don't want to be beholden to the insurance carriers across the country. I want to do what's best for my patient, nothing more and nothing less. Right. But to go back to that story that I started to tell you, I was on an airplane once, actually going to lecture at one of the major conventions. And I was flying to California, and I was sitting in business class next to a gentleman, very intelligent guy, who started one of the types of things that we're doing now, like the sessions that can record and so forth. He tells me, with 50 individuals, sold the company with 50,000. Now, this is an accomplished person for sure. I smile every time I hear people that have whatever it is, and it doesn't have to be that grandiose. But the reason for the conversation, we're sitting there, and apparently he's looking at a thing about electric cars, which he had invested a lot of money in a specific company. And I said to him, I have a question for you. What two of my patients said that driving an electric car, they were engineers, would produce a tremendous amount of low energy force, this magnetic field, which is very damaging to the DNA. Do you know anything about it? And he said, no, Mitch, I don't. But we had, Wi-Fi on the way, and he's typing to this particular company. The point is they never answered, but it didn't matter for this conversation because we're in the conversation. About an hour later, he looks at me, he's, you know what, Mitch, I have a very good cardiologist. And the cardiologist told me that if I enjoy my life and really having a good time, so what, if you lose 3 or 4 years at the tail end of it.
Today's podcast is brought to you by Gematria Products. Gematria is based in Carlsbad, California, and they manufacture ultra-high quality dietary supplements using QI technology. Qi, as you probably know, is the energy that runs throughout our bodies and is the basis of Chinese medicine. Use the code AGELESS and get 20% off your order. I highly recommend Gematria's products. I personally use the Complete Aminos, the Heart Gems, and the Methuselah Life, which is an RNA and DNA sublingual spray. The website to go to is www.gematria.com/QI-technology. And there you'll find out more about this fascinating company, their products, and the technology.
As it referred to the fact that, this could be causing a low electronic magnetic field and may cause a problem. So I said, okay, I see where you're coming from, Mike, but let me frame this differently. And the folks watching can think about this too, because I think this is the key to how we approach a patient. I said to him, listen, God comes on this plane right now. He comes walking right up to you. And he says, you know what? I'm going to give you 2 choices, only 2 choices. The first choice is I'll give you 10 years of life from here out. 10 years, you'll be perfect, like you're a teenager. You won't be sick at all. You'll have energy. You'll be able to do anything you want, play sports, whatever. But in the end of the 10th year, I'm going to quietly sweep you away in your sleep. The second choice is I'll give you 50 years, but during that 50 years, there's going to be some real problems. You may need a feeding tube. You're going to be in a wheelchair. You may need help even going to the bathroom, feeding, etc. Which do you choose? And he goes, Mitch, of course, I would take the 10. And as he started to say the 10, he said, now I understand. I said, exactly. Quality is always more important than quantity. And quantity does follow quality. So the way of producing a decent or healthy patient, so we should say, the way of getting there is somehow get them to this optimal situation, optimal health, optimal biochemistry, and optimal function. That makes sense, right?
Mitch, I always say knowledge is power, and information, of course, is part of knowledge. So this is why a person like you in practicing in the world today is so critical to the individuals who have that same commitment and say, I'd rather live 10 years of quality than 50 years of compromised health. So because of that, and by the way, because those 10 years can now be extended to a lot longer number of years once you get to that quality outcome. So, it builds on itself. So let's get to some specifics, okay, of how to get to that level of quality. What do you think are the foundational aspects of lifespan, health span? What are the key ingredients that you have to cover when you're trying to get people from A to B?
That's a great question. I think the very first thing that you have to do is to be able to determine what we're working with. It would be no different than a software engineer knowing exactly what are the pieces of the puzzle. It would be no different for a car mechanic to do a 155-point check on the car. And there are only a couple of particularly thousands of examples I can give. So the very first thing I want to know, in addition, of course, always to what healthcare practitioners are taught, history of that individual and physical exam, I need to know what's happening under the covers, what's happening in that body at a cellular level that you can't always tell by looking at the exterior. I can't look at the exterior of a car, for example, and know if the brake fluid's low or the oil is low. So that has to be tested. So I first look at someone and say, the typical evaluations done in most PCPs practices, most of the family doctors and general internists, is a very small biochemistry look, maybe a complete blood count, maybe what they call a complete metabolic process type of count as well. But I do a deep dive. I'll do probably 120 or more different parameters so that I can get the best understanding. No different if you took your car in 60 years ago, they looked under hood, they said, you know what, Mitch, your carburetor's okay, you have plenty of oil, done. We'll change the air filter. That's not the way it is anymore. You take a new car now and they hook it up to a computer and they sort of look as many parameters as a computer can. And it's a much, much more in-depth look. Why aren't we doing that in a system that has somewhere around 868 trillion chemical reactions per second? That's us. And yeah, that sounds like an enormous number, but someone once said and looked into it, that's about what we do, considering how many cells we are and what's happening every second and millionths of a second in the body. Now, we can't do every chemical reaction. We can't look at everyone. But are we doing a deep enough, comprehensive evaluation so that we get a good idea? Now, I liken this to patients that don't understand it, to, like, for example, an EKG. An EKG was founded around the turn of the 19th century, 1900s. And they basically saw the EKG to be able to give a 360-degree view, they would need 12 leads. And that's what our EKG is today. It looks all around the heart to give an idea of the information it provides, as far as enlargement and rhythm and so forth. So we need to do the same thing when it comes to affecting longevity. And I'll get to why in a moment. So if we do a deep enough dive, then we're going to find the things that are potential issues that could affect longevity, health, etc. And there are no circumstances that lead to just one problem. In other words, a set of maybe 5 abnormalities may lead to cancer in one patient, nothing in another, and perhaps an autoimmune disease in another. So we're looking to see where are the potential cellular difficulties. And by doing that, we can replete the areas of difficulty simply, easily, most of the time using natural type of medicine, and occasionally using medicine as well, but most of the time we can do it naturally. And this will forestall biochemical failures in the future. This will forestall mineral failures. Regardless who the patient is, if you even take one mineral and you deplete that one mineral, regardless of what it is, you can name anyone you want, eventually you'll have a problem, or what we call a disease. So are we going to wait till that happens? Or are we going to really insert true prevention and make a difference and keep that person alive? So my very first step before I do anything else is to evaluate what that person's biochemistry. That's first.
And that's how many blood tests does that take to, I mean, obviously today's technology, there's so many ways you can look at the biochemistry. So if someone walks in your door, new patient, and you're going to do what you just described, what's next in terms of the lab work?
Well, that would be the lab work. And it would usually, in my office, we do it in 11 tubes. If they go to the outside lab phlebotomists, unfortunately, for each test, they take another tube. They don't realize
Right.
you could do 5 tests out of one tube.
Right.
But usually it's 23 or 24 tubes on the outside. We do it on the inside for about 11 tubes. You're talking a week and a half, 10 days. And then we have a pretty good look at who you are from a biochemical perspective. And then what I do is I usually add on a physiologic test, like, for example, the evaluation of the autonomic nervous system or the evaluation of the brain, depending on what that person told me in the history, what I find in the physical, what issues they would like me to address. And I'll usually add those together. I never treat on the first visit. I basically wait till I have everything in front of me. And then when I bring the patient back, I can talk quite intelligently about them. And it's pretty much, I would say, more than 99% of the time outside of what they've heard before, because they have not been through enough comprehensive evaluation. They haven't been through that 155 car computer check before. That's how I start.
So what would you say is the most important blood test if you were going to do only one and you couldn't have the benefit of today's technology with all the different measurements? What would be that one test that you would absolutely require?
That's a great question. I used to think about this a long time ago when I used to teach physicians early in my career. I used to say if you only had one test, it would be the CBC, the complete blood count, and a urinalysis. You can gain your most information from those two tests than any other. But in today's day and age, there should be no reason why you can't do an extremely in-depth dive, because missing either one thing could literally change the outcome of that person's aging in future.
Right. And the other thing too is that all aging begins in the cells. And so, the CBC is it's like a primer. But if you really want to look at the health of the mitochondria and the cellular elements of the body, the CBC is certainly not going to give you all the information you need. So,
No.
well, that brings me to something that I want to be sure we cover today. And because of our wonderful friend Roberto, I've been looking into I met him at A4M. And so I did all his testing, the WAVI and the ANS and all. So let's talk for a moment, because you are the chief medical advisor. What do you think those tests and his technology, as Hugh Light, will do for your patients, and when do you not need to use it, and when do you think it's absolutely essential?
Okay, let me separate two things. As the chief medical officer of Hugh Light USA, that's really a composite of 4, and we can get into talking about this in a moment, 4 instrumentation that to me is probably the most technological advanced instrumentation in the world. Alongside of that, Roberto works in a space providing a couple of diagnostic instruments, which are well proven and tried and true, which are the ANS machine that you're alluding to and the WAVI. So you asked a great question, when would I do that? So to understand when you would look at the autonomic nervous system, for the viewers, you would have to say, what is it and why is it so important? So the autonomic nervous system pretty much does everything for you that you do subconsciously. So sweating, heartbeat, respiration, blood flow through the heart, pancreatic work, digestion, of course, liver, all those things. And the autonomic nervous system is separated into 2 components. The one that everyone knows is called the sympathetic, or better known as the fight or flight.
Right.
And then the opposite, and it's called the parasympathetic, which is the rest and digest. Now, fight or flight systems like this, the ANS, is a component of every single animal in the world. we have it because it's meant to be a safeguard to get us to get away from an enemy, to get away from a fire, whatever it is, to be able for us to, our body to become physiologically or functionally correct to move it. So the sympathetic nervous system is one in the animal kingdom. It's meant to be used for a brief time, and then the parasympathetic takes over. Mm-hmm. So the human, unfortunately, we have taken this system and we've broken it. And every single thing in the human body unconsciously done always is initiated by the sympathetic. And then the parasympathetic says it's okay. There's a lion. No, there's not anymore. That's how this particular combination of sympathetic, parasympathetic works. Now, how important is that would be to tell you that 9 out of 10 diseases that kill humankind either initiate in the autonomic nervous system or they complete in the autonomic nervous system. You can say, well, which one doesn't? And that's trauma. So obviously, if there's a car accident, it's over so quickly, there's no adjustment in the autonomic nervous system. But prior to that, pretty much every disease will have a dysfunction of that. So when we say how important that is, I'm going to say it becomes exquisitely important. If you're pretty much over 35 or 40, you should definitely get the test done once a year. Typically, these are conglomerative tests that started in the 1960s. Harvard and MIT's algorithms are placed within these things. And it gives an amazing overview to where the patient's at. Do they have heart disease? Is their vascular system, the 64,000 miles, has it been affected? Do they have way too much sympathetic discharge? Is it affecting the heart? Are they more likely to have a heart attack? Are they more likely to have a neuropathy? Are they more likely to have a dysrhythmia of the heart? That's a lot of information when you couple that with the blood test. So it is, for me, an absolute go. So when I see someone, let's say, and they're not a teenager there for acne, or someone who's there because most of my patients have been referred to me by other doctors and people throughout the United States that have issues that are not being resolved by the conventional community, then what I do is always the blood work and with the autonomic nervous system evaluation. I am ahead of the game so much by that point, it gives me an idea. Now, add to that, to finish the question you had asked, if, for example, someone has, maybe some early cognitive decline, or, I just can't remember those names, Mitch, like I used to, or I've had a lot of closed head trauma comes up in the history, then the one similar to the autonomic system basically gives me a functional display of what's going on from the neck up. Let's say the ANS is from the neck down, so to speak. The WAVI gives me from the neck up. So it becomes also a very important tool in my armamentarium to be able to determine and diagnose folks of exactly what's going on. Because the more we know, the more we get to that bottom question, why? And there's a perfect example to this. I saw a young lady who wants to go to law school a couple of days ago. She's homebound. She's been homebound for a year and a half. She's so anxious. Her gut's bad, blah, 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 and she's having a hard time. So someone, rightfully so, looked into the gut and did all the proper tests, another integrative person, but she wasn't getting better. She was taking things. And after listening, I said, I have to tell you, I think this is the case where whether it's the cart before the horse or horse before the cart, have not looked in the right area. She said, what do you mean? I said, well, this is sympathetic, well overcharged. This is sympathetic dominance. And we need to determine that. If we do, I'll know exactly what to do. And she said, what do you mean? I said, well, you're in, I think, a chronic state of fight or flight. She goes, you know what? My psychologist told me that too. And I said, yes. And I said, I'll tell you something else. When you fall asleep, I'm going to tell you, you have no problems with your stomach. I'm also going to tell you that when you're engaged in something, watching a television program, which you're really immersed in, or doing something you're really immersed in, you probably don't have it then either. She thinks, looks around. She goes, you know what, Dr. Mitch, you're right. I said, yes, because you haven't engaged that fight or flight as much. And by the way, engaging the fight or flight it begins as something that you need. It progresses to a massive amount of adrenal hormone, cortisol, eventually cortisol failure. It addresses and goes further to cause severe inflammation. And for everyone watching, I think they should know that inflammation is the nidus for every disease from heart to cancer. So it is an important valuation that we need to do.
Right. Inflammation and oxidative stress, they're like the two twins, right? That are the main culprits for aging. So if you can, that's why antioxidants are so important in our regimen, because we want to reduce the inflammation and oxidative stress. Which, hey, listen, I broke my ankle on a bike accident, and they told me the inflammation was a good thing in the beginning. It's when it lingers and you don't resolve it, but you do need inflammation. It's sort of like saying about cholesterol. People say, oh, cholesterol is bad, but actually cholesterol it is very good, and the brain needs the cholesterol. It's just a question of what kind of cholesterol. So I love what you're saying, and it's so helpful. And I know there's a couple more elements here. One is molecular hydrogen, and the other is the red light, which hue light has the big bed, which the Cadillac, let's say, of red light therapy. So why don't you talk a little bit about how important those two protocols are for the same kind of outcome that we're aiming for, which is optimum health and longevity.
Of course. And you hit the nail, Michelle, right on the head. We have way too much oxidation because of stress, what we eat, way too much inflammation. And that's where the hue light equipment, which is a Korean-born equipment that comes over, is magnificent in this fight. So let's start with molecular hydrogen. What molecular hydrogen is: anti-inflammatory, antioxidative, and it is modulating of apoptosis. For those that don't know what that means, basically at some point cells need to die to let the new cells come in. Molecular hydrogen, or hydrogen, is the smallest molecule we have, as you know, in the universe. It is the molecule of creation. If you look at creation, water, which covers pretty much 3/4 of the earth, can't live more than a week without it, is H2O, 2 molecules of hydrogen, and of course, 1 of oxygen. Molecular hydrogen in its antioxidative state is what we call a selective antioxidant. It actually stops 2 of the very dangerous reactive oxygen species. One is called the hydroxyl radical, which is a fairly dangerous one. And the other one is the one that causes DNA damage. And it's known as the ONO type of oxidator. It's OONO with a line on top, or what we call peroxynitrate free radical. It is selective for stopping that. And that's the one that will eventually cause DNA to be damaged and all the things that come along with that issue, whether it's cancer propagation or invasion or metastasis or it's heart disease, etc. Well, the breathing of molecular hydrogen is and allows this to go in. It initiates what we call the NRF2 system, which is anti-inflammatory and actually begins to increase all the antioxidants and helps anti-inflammation, and also sets off this capability of cells that are old time to die. And molecular hydrogen, when it's inhaled, is very easy to use, Michelle. If you think some people watching may say, well, you know what? I drink hydrogen, molecular hydrogen. Well, just so that I don't belabor it, unless you have other questions to it, a 1 hour use of molecular hydrogen at about a rate of 2,000 cc's per minute, which actually translates to 1,466 cc's of hydrogen, because you have 1 molecule of oxygen and 2 of hydrogen. In 1 hour, for someone to be able to drink enough liquid hydrogen to equal that. It's
Right.
about we say 240 ml glass, which is about 12-ounce glass. They would have to 36,000 glasses. That's insane. It just can't happen.
It's like throwing a pebble into the ocean. It's nothing, but at least you're doing something, but it isn't going to have the outcome. But and how do you combine the? Sorry, my voice is so bad, but how
It's
do you
fine.
stitch the molecular hydrogen with hyperbaric oxygen? Do they go hand in hand in any treatments that you would be looking to use?
Absolutely. What I do in my office, I have all my patients basically go through all four of these treatments. We have things called medical gases. Pretty much the molecular hydrogen is one. One knows what oxygen is. So hyperbarics increases the amount of oxygen within the system because, it causes pressure pushing it into the system. That's where hyperbarics come in. We know also ozone is another molecular gas that's used by lots of integrative practitioners. It's extremely helpful as well. So what I do is I put patients when they first come in on a sonic plate. It's not a shaking plate. It actually is a sonic or sound wave, and it goes through different frequencies at different intensities. And the one thing that I find with that specifically is it takes what so many of us have, and that's these glued together red blood cells, either this aggregation or Rolu formation you could see under a dark field microscopy, and sort of breaks it up so the cells are free. Now, why would you want cells free? Makes sense because red blood cells have an elliptical shape. They're made that way so they have the maximum oxygen capacity, carrying capacity. So that's first. Then I put them in this unbelievable near infrared. Infrared's broken into three spectrums: near, mid, and far. And we can always discuss if we have time. But the near infrared system has 38,800 LEDs. So based on distance and what we call luminescence, and this has both in the proper amount, it equals the amount of near infrared that you could receive on a perfect day in the sun at the proper time, which the proper time for near infrared happens to be in the morning hours when the sun first comes up, and the latter part of the day when the sun's going down, not the ultraviolet, but the near infrared. And not only does that initiate something that you alluded to, which is perfect, which is mitochondrial enhancement. It is this light that actually gets the mitochondria to work better, because in the mitochondria, there are what they call chromophores. They literally are parts of the mitochondria that look for this light to make the mitochondria work and make the mitochondria produce melatonin to save itself and keep itself healthy. So this is a perfect adjunct to the system that we're using. And so using all these particular systems, of course, and with the molecular hydrogen, they're all doing a little bit similar, but like a Venn diagram. They have the overlapping places, but then they have their individual specific areas that they're doing the job. So you're really with nothing that's intravenous at that point, nothing that's aggressive, but something that your body requires. You require oxygen, you require sunlight, and most people were sunlight deficient, pretty much the entire population. We're inside, we're working, we're doing, and do we really get out in time and get our whole body exposed? Of course not. But 20 minutes in this unit of the near infrared gives you everything that you need for one day to stimulate that mitochondria. And there are hundreds of other reasons, including the eye and having, macular degeneration and mouth lesions. I mean, I can go on and on about this near infrared. So the combination is about as close that we can get to the concept of a med bed, which hopefully one day we'll really have. But this is about as close that we can get using this technology that Hue Light USA has brought to this country. It's that spectacular. And I don't have a patient that I don't have that combination bolted on to all the other things that you and I have discussed, from nutrition and whatever it is. IV, etc. This is absolutely part of their program because there's no way of getting healthy unless you do what I always say, diagnose someone 360 degrees, which is what we teach, and treat them 360 degrees. So that combination is the biggest winner for optimal health.
When I think about everything you just said and how it could be revolutionize your health, but yet it's impractical for most people who will not have either the money or the space to have all this equipment. So how does one handle the practicality of all of these protocols influencing their health when they can't access them unless they're in your office or they have the financial wherewithal to put it in their residence?
Good question. Let me take the, I guess, the former question before the latter. There are other offices other than mine across the United States, and it's growing amount of practitioners that have these types of instrumentations that are be putting in. They're not cheap, but the outcome is that great that it makes it important. So there are, if it's California, there's California. In Florida, there's some in wherever, Connecticut, wherever someone lives, usually you can find it. You're right too. Unless you have a lot of money, it would be financial, probably prohibitory to put it into your home. But you have brought up another point, which is a point not just for just equipment. It's a point for integrative health to begin with, especially since so many of the doctors that are in this space are cash practitioners like myself. And it sometimes becomes difficult for patients to avail themselves of the services, and there is really no good insurance potential yet. They talk about it all the time, but it's not there. But there are several things that can be done. And I tell folks too, when patients come to me and they have difficulty, but they want to do the services, they recognize how important it is. Well, first, there's a concept that I need to tell you of how I think. One, I've learned a long time ago, I never look in the pockets of patients. I had 3 offices in upper blue collar workers areas. And if they could not afford it originally, they would find it, family members would help, because the recognition of good health was much more important than the Del Monte steak or whatever else they would go. I've also watched in my own practices, which again, I never look in someone's pocket. Again, I've watched people come in, tell me they don't have enough money for a $20 item, and they'll drive off and brag about their brand new Mercedes 5 something. Right. So I don't look in the pocket. I think the first thing that the population needs to recognize is there's nothing more important than your health. And if you want to be in the Band-Aid population, then you don't need me or any type like me. You can go to a PCP, and that you probably can get on your insurance these medicines and so forth. Medicines are a Band-Aid. The underlying cause is eventually going to get worse. You'll need more and more. I teach, and I've had on my programs many of these kind of practitioners. The other thing is, don't be afraid as an individual to be able to say to a doctor, look, I need a little bit of help. Most people, I think, at least I do, I can only talk for myself, Michelle, find a way of helping them so they can afford it. I'll do whatever I can to help them one way or another. And there are people out there, and there's several in my practice, who have helped many patients by even paying for their whole treatment protocol. So I would not say I wouldn't want a person to say, I'm not going to go to Mitch Ghen like that, knowing that I don't know if I can afford it. But once they got there, if they're honest, I go through everything possible to always help that patient, because they're a human being. They need to be helped. And so we look for answers for it. But you're right. It's not as easy, but if someone will prioritize their health and are willing to work and fight for good health, then you should have a doctor on the other side, or a practitioner that's willing to fight with you for your good health simultaneously.
That's very refreshing, and I'm sure it's music to the ears of a lot of the people that will be watching this podcast today. So thank you so much for sharing your philosophy with us. And hopefully people, if they can't find you in Boca or, head to Florida, they can maybe at least consult with you as the first step on a telemedicine basis. So we'll talk about that and how to reach you in a little bit. But I did want to ask you a couple other questions. I keep getting inquiries about thyroid.
Mm-hmm.
I think thyroid is probably one of the thyroid, or hypothyroidism, probably the Hashimoto's, or the low thyroid is probably
Mm-hmm.
one of the greatest epidemics of our time. I think I know the reasons why. I'm sure you can tell us, but I would love to hear your thoughts about how to improve thyroid naturally without having to take pharmaceutical drugs. Is there anything you can first share with us about the reasons that thyroid is such an epidemic, and two, what can we do about it?
All right, let's start with the reasons that the thyroid is a much difficult problem. The reasons it's a problem for many. One is simply the toxins that we breathe in every day, number one. Number two, there is so much radiation. Every time someone goes to the hospital for anything, because of the fear of missing a diagnosis and, retribution by some a personal injury attorney, CT scan will be done. That's radiation. Then you have the medications that are irritating to the thyroid as well. We don't have enough iodine in our bodies, which we'll talk about in a moment. It's important for the gross functioning of the thyroid as well. And we have so many things from, for example, food coloring, and anxiety and stress, and preservatives in the foods, and all these things. And then you put on, like, a woman typically will have 250 chemicals in her system before she even walks out of the house in the morning. What she washes her hair, what she puts on, the makeup. Men, 100, 125 easy. I always say, for me, who's pretty much metrosexual, I have 1,200 in my system. But I do try to make sure they're all as natural as possible. But these chemicals do their dastardly deed, so to speak, and they will irritate that thyroid. Thyroid's a little gland. We have tons of items that are also, like in foods, like chlorinated products, the halogens, all irritate that. Fluoride in toothpaste, in water, and the list goes on and on. So we have so many things that we're subjected to. We're having that problem. Then we have another problem. We start to find drugs that we think will help people lose weight, like the new ones you're familiar with. And if you read the black box warnings, it talks about incidence of increased thyroid cancer in one of the black box warnings. Mm-hmm. They did a study, don't quote me where it was, but basically they looked at women somewhere between the ages of 40 and 70 that passed away from something else than thyroid. And they did autopsies. They found 100% of the women already had thyroid cancer, even though they had not developed the overt symptoms. So something is wrong. You're on the right track for sure. We have way too many things from, plasticizers and things that are going into the thyroid. To answer the second part of your question, and it's hard to get away from all those things. You said, what can we do to improve the thyroid function? Well, one of them is a general measure that we found, for example, in Hashimoto's thyroiditis, which is an autoimmune thyroid that eventually will lead to the body's destroying the thyroid and becoming a severely hypothyroid. That one of the ways we measure it is by TPO, or thyroid peroxidase. And we actually have found that red, near infrared, 2-3 times a week for a couple months actually reduces it significantly. So infrared. And then for those that say, well, I can't afford it, I can't get it, just to go on for what you said, well, out in the sun, get up early in the morning, get out in the sun. Later in the day when the sun's going down, extend your neck, let the that good light go into your throat, and that's going to help. But the other things that will help are the things that help convert the thyroid into producing at least the beginning, which is T4. Right. T4 is not the active form. T3 is. I'll get to that in a minute. Right. So to get to T4, you have to add iodine, you have to add selenium into your diet. You need some of the B vitamins just for sure that will also help to accentuate that. Zinc is required. And there are formulas, for example, that I make that have all these in them that help to convert that into T4. Now, T4 to become active at the organ site has to convert to T3.
Correct.
But to do that, you need to be a good methylator, meaning that you have to be able to put CH3 groups to change it into the active form. So taking an active form or a methylated B complex 1 or 2 times a day, along with the other things we just said, L-tyrosine, by the way, another one that just came to my head, will help you convert this to the active. So that's how you try to prevent and keep that thyroid healthy. Minimizing exposures to things that we just talked about, certainly taking a supplement with the things we just talked about, and also taking a supplement of methyl B complex or methylated B complex to help convert it to T3. That's the best options we have.
Okay, so what's the best thyroid supplement that you found in your practice?
I actually make almost 85% of the supplements that I use. I make them in what I call therapeutic doses. It's direct from the manufacturer. It's not in the stores. And the one we have something called thyroid support, and has every one of those things that I told you about, minus the methylated B, which I also have made. So that thyroid support is fantastic. It has enough iodine, enough L-tyrosine, enough selenium, enough zinc to help that thyroid convert and get that T4 excreted, the thyroxine out, and then to convert it, obviously using the methyl B. And like I said, if someone does have early stages of Hashimoto's with elevated antithyroid globulins and thyroid peroxidase, TPO, I also use the near infrared. The combination is extremely successful for allaying this, the death of that thyroid through your own body seeing it as foreign, which is what an autoimmune disease is.
So this is going to be a out of left field kind of question, but let's just say someone's gut is unhealthy and they're not absorbing nutrients, and here they are taking your wonderful supplements, but they're not actually absorbing them. So how do you deal with that when someone isn't healthy enough to get the benefit from the methyl B and the thyroid support, as 2 examples?
It is correct that if the gut is not healthy, the absorption will be lower for pretty much any nutrient. So I think the very first thing is to be aware that whatever you take orally, on the best day of your life, you're looking at 40% of it being absorbed. As you add into it birth control, as you add into it diuretics, as you add into it proton pump inhibitors to stop acid or H2 blockers, as you add into it the age and the aging gut, which has very little acid, especially pretty much most females after the age of 50 don't have, men are not far behind in that, you're not going to have an absorption rate much more than 3 to 5%. And that is one of the issues that we have. And being cognizant of that means that we also try to make sure people, when we see them, that we do address that. So there are very good things that help your gut to work properly. And so, again, going back to what we developed something that literally has 4 things in it. It has hydrochloric acid, which is absolutely necessary for digestion, has the same symptoms having low as it is high, definitely is missing as we get older, and you can't dissolve these foods. It has probiotics. It has digestive enzymes. And 4th, it also has muscle things that are soothers, like marshmallow root and things of that nature. And that definitely helps in the digestive process. And pretty much, if that digestive process is off, all, as you said, and correctly so, all nutrients are going to be not taken in properly nor digested properly. And hence the reason I use intravenous route so much and so often. And was the grandfather, they call me, of it now, and wrote the textbook on it. But if you take this thing to help the gut digest properly, then these things will work much better.
Yeah, so it just seems to me that anyone that's listening today should recognize that you might want to start at the ABCs, start at A, which is to get your gut healthy, and make sure that all these other protocols that you're going to be using to be more specific to the condition that you have, let's just say in this case the thyroid, that they're going to work better. So why not start at the baseline and build the foundations? Like I'm a real estate developer by background, so I always use the metaphor of building a house. So if you don't have a good foundation on your house, guess what? You know, by the time you get to the roof, you're kind of throwing your money away. So I look at it in that same kind of analogy. So, you know, they just signaled me we only have 5 minutes, and I don't want to run out of. I knew this would happen to us, but I want to be sure that our viewers have some way to get in touch with you if they would like to. I know you don't need any patients, and you certainly have doctors and consumer individuals. So I'm sure I don't even know how you sleep, Mitch, when I look at how prolific you are. But let's just say that people are dying to speak with you. How would they reach you?
I'll give you a website address if that helps. It's Dr. Mitch at mitchghen.com. It's that easy. DRMITCH at Mitch Ghen, MITCHGHEN.com. And they can send me a message that way. And I'm really good about getting, I field almost 84 calls and text messages a day. So, and I never go to sleep until I cleared everything. So I will get back to whoever tries to get to me for sure.
And then I know Roberto, our good friend, said that he would he would love to offer actually an incentive to our viewers. And he did say that we would maybe have a 15-minute consultation. Here I am adding more burden to your already burdened schedule. I think what we decided offline, Mitch, is that we would just allow one person. That way we don't overwhelm you. So we're just going to make the offer today that the first person that contacts me at 808-639-0904 wins the lottery and gets to have a 15-minute, which I imagine will turn into a little longer, but I don't want to, I want to be sure we put limits around this, respecting your time. Is that something that will work for you if we?
Oh, of course, Michelle. Anything you ask me, I'll do. But that's fine. Yes, of course.
Well, now you just said all the magic words. Thank you so much. Okay, well, so I want to, as I mentioned in my email to you, I want to be sure that we have a round two because there is so much to talk about, and like it's any subject I bring up. I know you can talk for infinitely on, and this is what I really value. However, before we go, you had alluded to the GLP-1 agonist, and I know people on everyone's mind today is how do I lose weight in a healthy way, and are these drugs like Ozempic and Wegovy and Mounjaro, are these semaglutides the answer that seems to be, raging throughout the world today, but yet you and I both know that there are always going to be downsides. So if you could say one thing, one sentence right now to our viewers about those drugs, what would you say?
Don't take them. That you need to learn to do this from a functional human physiologic perspective. If you have diabetes, perhaps, but thyroid cancer, gastroparesis, and pancreatitis potential isn't worth it. That's my bottom line.
That's exactly what I was assuming you would say. The other final question I have for you is, I have in my house a far infrared sauna, and I'd like to know what is the difference between the near and the far, and is there a value of each one that's distinct?
Yes, and I'll do that in 30 seconds. There are
Okay.
three spectrums within the near infrared. The far is not that it goes deeper, it actually goes much less, because as you use far infrared, it vibrates the water molecule, heats you up. Nice for a detox, feel good, but does not affect the mitochondria at all, like near infrared.
Okay. Do they sell for home units? Do they sell near infrared versus the far?
Yes, there are home units that can, but you want one that does effectually get to the levels that would be as close to the sun as possible. And Light USA has a home unit. Still, it's fairly large, but it does do the job.
Okay, very good. All right. Well, I think we've covered all we can today. And I just want to again say thank you, Mitch, for your time. I know how busy you are, and you've just been so wonderful with sharing all of this information. So round two will happen in 2025 because we're booked to the end of the year. That's a good thing for us. But I will have my assistant get in touch with you, or I will do that directly to set up something for next year.
I look forward to it. God bless. Thank you so much for having me on your program.
Thank you, Mitch. Take care. Bye-bye.